prepare your child for a first dental visit. I'm Dr. Olga Dolghier, board-certified pediatric dentist here at Palm Valley Pediatric Dentistry. Well, let's dig in. It depends on the age of your child. If you have a child under the age of 1, there's not too many preparations you can do. You just bring your child in as kind of educational appointment, playing with kid. We might take a peek inside the mouth, clean teeth, and mostly talk to mom. If your child is older and you miss your 1-year-old, 2-year-old, 3-year-old, then a lot of toys can be handy. First of all, there is a lot of books available about first dental visit, and you go through the book with your child, kind of discuss everything and prepare them mentally. Also, you can have toys. Toys are very helpful. There's toys available like Big Hippo, where you can actually look inside the mouth of the hippo and check the teeth for cavities, maybe replace teeth, so play around with that. If your child needs dental treatment, you can use different toys. You can use Play-Doh and use child-friendly terminology. For the first dental visit for cleaning, x-rays, we use child-friendly terminology. Instead of saying x-ray, we say we take your picture. Instead of saying we're gonna clean your teeth, for example, we say we're gonna brush them, we're gonna make them shiny, we're gonna put shiny fluoride vitamins on your teeth, or special Spider-Man vitamins. So this kids-friendly terminology really helpful for us to manage your kid and for your child to be prepared. Those are little tips here and there what you can do to make the appointments much more smooth. If you have an older child who never been, you might just tell them what to expect in general. You can have more adult terminology because they, after the age of 12, for example, they are well-rounded and they know what dentist is. And explain that first appointment, we just do cleaning and evaluation. That would be absolutely appropriate for that age group. So it all depends. If your child already had negative experience in the dental office. Sometimes we do desensitization appointments when we bring your child in and take a kind of a walk around tour. They sit in a dental chair, they practice to take pictures, and then they leave the office. We provide this type of options in our practice. So you have to have realistic expectations. Sometimes it works great and child just needs to overstep those boundaries, but sometimes it doesn't. It depends on their ability to cope, ability to comprehend, and child's temper as well. So there is a lot of variables. But don't be afraid, don't stay home and don't transfer your anxiety into your child, because a lot of times we can tell the child is absolutely fine. Mom is the one who is nervous. Mom is transferring that whole negative emotion, anxiety, and experience into that little kid. So let us handle those comprehensive and difficult type of tempers, and we can definitely make that appointment the best appointment for your kid. Every child has different temper. So I have 3 children. My youngest child always had very strong-headed girl. She is strong personality. And one day we had a terrible accident. When she was 3 years old, she actually was playing mermaids. She put a big towel on, her hands were restrained, and she was walking like this. Guess what? She slipped and fell down, face down on the tile. We rushed to her, she cried, blood coming out of her mouth. We looked and her 2 front teeth were very mobile. So we put an ice, kind of calmed her down, but I had to take her to the office to take x-ray. And it took us a while to get x-ray on that girl. That's my own daughter. I use all my special techniques and everything else, nothing works. My husband had to hold her. We got the x-ray done. Fortunately, nothing needs to be done at that point, but that's a good example of her personal temper, her experience, and unfortunately, sometimes we had to do that. So that's one of the little stories for you of my personal experiences. Now she is much older and does extremely well in dentist and not afraid of anything. So sometimes those bad experiences do not define who your child will be and what her behavior will be in the future. How do you prepare your child for the first dental visit? Did you have any special hints or do you have any special tricks? Share with us, we'd like to know. And thank you so much for watching my channel.